it's been a quite chemotherapy ASCO this year for prostate cancer. And if you think about it, docetaxel chemotherapy or taxane chemotherapy has been the standard of care for patients with metastatic castration-resistant disease for approximately 10 years. But those were really advanced stages of the disease. And now we have the first generation of trials, phase 3 trials, maturing in patients with non-castration resistant disease, namely for M1 disease, upfront metastatic disease, and now also for patients with localized disease, but features for high risk of relapse. So let me just separate that a bit. For patients with M1 upfront disease, I think now we have 3 trials, all pointing to the same direction: GTUC-15, Stampede, and Charted. They all show that progression-free survival is improved if you add docetaxel chemotherapy on top of classical ADT, and in 2 of the 3 trials, overall survival is also significantly improved, while we see the same trend in the 3rd trial. So I guess my take-home message would be that docetaxel is probably now the standard of care on top of ADT for this patient, at least for fit patients that can tolerate chemotherapy, and of course patients who are willing to get chemotherapy, but because not of them wants to get chemo. Now the second piece of data that just emerging at this ASCO meeting is for patients with localized disease and high risk for relapse by T3 disease, high PSA, high glycemic score, all these things. And for these patients we also have now 3 trials with data. GTUC-12, which was just reported in the Lancet Oncology this Friday, support that if you're using docetaxel chemotherapy for these patients, you're indeed postponing relapse and death. So relapse-free survival, which was the primary endpoint, was met. So that was really a first. Now today at ASCO, we also saw that in Stampede, the subgroup of patients with a high-risk localized disease benefit from docetaxel chemotherapy in terms of time to relapse. Now, overall survival was not met for these particular patients, probably because the follow-up is not long enough. And finally, a US trial from the RTOG group supported a small overall survival improvement, but it's probably a little premature to make sure that this is true. It's 93% overall survival rate in the docetaxel arm versus 89% in the control arm, so it's still a quite small difference, and the p-value was not two-sided. So I guess it's a little premature, but I guess it's showing us that this is the right direction where to go. We're postponing relapse. Now whether we will also postpone death is another story, and we will need longer follow-up.